Welcome to Walker Methodist Health Center in Minneapolis, Minnesota. We're here today in the Walker Dental Clinic to visit with Dr. Steve Schuman and dental hygienist Peg Simonson from the University of Minnesota School of Dentistry to learn about oral care for older adults in the long-term care setting. Because of today's rapid growth in the older population and steadily increasing expectations of better health care by our society, there is an increase in the need to provide comprehensive dental care for older adults. Previous generations of older adults and their families may have accepted dental problems and tooth loss as normal, but not anymore. In the 1950s, less than half of adults 65 and older in the U.S. kept their natural teeth, compared with 80% today. And in Minnesota, about 85% of those 65 and over still have some natural teeth. Those teeth have been through 60, 70, or 80 years of use, so they need continued care to keep them healthy.
I'd like to tell you about this patient that was 99 years old, and she brushed her teeth all the time, morning and lunch, 3 times a day, and she lived to be 100, and she had all her teeth, and all 32.
My philosophy personally is we need to provide the same level of oral care to somebody whether they're 20 years old, 50 years old, 70 years old, 90 years old, as well as whatever stage they are in their life cycle.
I think all of us would like to have the type of care that we have now as independent adults. As we become more dependent on others, it would be nice to know that there will be someone there to help you with your daily oral care needs when you can't do those things yourself.
None of us as we get older are going to have regular, normal mobility. If I don't have any transportation and my children work, I want availability. I want to know that I can be assured that I have services available to me that let me feel a little mind at ease.
My expectations for oral health for residents are all based on the individual resident's needs. And some residents can be independent and take care of themselves. Other residents may be comatose or non-responsive and are breathing through their mouth all of the time, so that their mouth will get very dry. And so the expectations for the resident would be based on their assessment and on their needs.
From my point of view, having regular dental care and having the right things available to meet the dental needs, for instance, dentures, partials, making sure that they're not in pain with any dental health issues, as well as having any infections that could affect their medical health, because that can affect their ability to participate in life as well.
Well, when it comes to oral care, my recommendation would be to healthcare workers that we have to remember that we are dealing with people from different diversities. So dealing with these people, they have their own issues. We need to understand that people with different backgrounds have different way of doing things.
Legislative mandates at both the national and state levels also now exist to improve both the recognition of dental problems among facility residents and access to routine professional dental care.
This is the right thing to do for organizations to provide great oral care, oral hygiene, dental care. Beside that, it's a requirement, a regulatory requirement, and a requirement that is getting greater emphasis and from a regulatory standpoint, be it at a state or a federal level.
While the primary diseases of the mouth are tooth decay and gum disease, there is now strong evidence that oral disease is also related to other serious health problems, such as diabetes, respiratory illness, and possibly heart disease and stroke. Oral cancer can also be fatal if not recognized promptly. Many medications that are now used to treat medical problems can also cause oral health problems, such as dry mouth, which can lead to tooth decay and soft tissue problems.
We've known for some years that there is a strong relationship between oral health and diabetes in terms of periodontal health or gum health, that people with diabetes are more likely to have problems with gum disease, but also that people with gum disease are more likely to have problems controlling their blood sugars. And we're also looking now at a growing body of evidence that may indicate that poor oral health and bacteria in the mouth may be associated with cardiovascular problems such as strokes or heart attacks.
Good oral health is also important in ensuring proper nutrition and the ability to talk, taste, smell, chew, swallow, smile, and even kiss.
Well, you always feel better when you can smile, and that's the first thing that people see on you is if you're frowning or smiling. And I've always experienced that if I smile, they'll smile back at me. So I enjoy smiling. And going to the dentist really helps that.
Because medical and functional problems can put older people at increased risk for oral diseases, it is vitally important that they receive regular professional dental care to reduce the impact of dental diseases on their quality of life and general health.
The ability to chew and enjoy food is a huge thing for nursing home residents, that if they have to go to a pureed diet, that's often not as appetizing for them, and it makes them feel even more like they're in an institution rather than a home-like environment. And so if we can maintain oral health so people could have either keep the teeth they have or have dentures that fit appropriately and allow them to eat the foods they enjoy, that goes a long way towards quality of life.
Individuals have an important role to play in managing their oral health. For those unable to carry out daily hygiene routines for themselves, family members and caregivers also have an important role to play.
I think even at age 88, my mother wants to feel good about herself. She wants to look good. Again, she wants to be able to smile with those pearly whites in place. She polishes her fingernails at 88, so appearance is very important to her.
The goal for every individual is to keep a healthy mouth for life, a mouth that is free of pain, infection, major tooth problems, gum disease, other soft tissue problems, and denture problems. Now that we know the expectations, let's take a closer look at what should be done to ensure good oral health for older adults, especially for those in long-term care residences. Normal aging changes the environment of the oral cavity. The outer surfaces of the teeth begin to wear, and teeth darken with age. The nerve inside of each tooth begins to shrink with calcification of the pulp space. This can reduce an older person's awareness of possible dental problems, such as cavities. There is also usually some gum recession causing root exposure, which places teeth at greater risk for developing tooth decay. The most common cause of oral health problems in people of all ages is plaque. Plaque is a soft layer of material that accumulates on the surface of the tooth and is composed mainly of bacteria. This is the fuzzy film that people feel on their teeth when they wake up in the morning. It is this accumulation of bacterial plaque that causes both periodontal disease and tooth decay, since the bacteria in plaque can use the sugar from food as fuel to make acid and toxins that irritate the gums and decay the teeth. For these reasons, it's important that facility staff performing cares for residents include daily oral hygiene as part of the normal care routine. This includes regular use of a fluoridated toothpaste, which can prevent tooth decay, brushing twice a day to remove food and plaque from the teeth, and also trying to floss if possible to remove plaque from in between the teeth, and denture and soft tissue care, which can prevent the onset of oral ulcers, yeast infections, and other abnormal changes in the soft tissues of the mouth. Helping residents get ready for a dental office visit by first reminding them of their appointment, and then completing oral cares and toileting at the right time so that dental treatment goes smoothly. It's important to have the correct tools for these procedures and take into consideration whether or not the resident is mobile, bedridden, or unconscious. It's also important to maintain resident safety and privacy at all times.
Where I work on my floor, my supervisor, she makes sure we have every supply. So when it comes to supplies and other stuff, it's not hard, like giving good oral cares or any cares, whatever you want, because everything is in the room. Like toothbrush, toothpaste, the emesis basin, everything is there. There's no excuse that you don't have anything, that you cannot do the care, and it makes it easy for us as nursing assistants.
Some situations may require alternative tools, such as special floss holders for residents, special prescription fluoride toothpastes, or antibacterial mouth rinses. Keep in mind that proper infection control precautions are important no matter which cares are being performed.
A very tough supervisor, if she comes around and she notices that a person isn't getting the right care that they need or doing what they're supposed to do as a nursing assistant, she tells me straight out. She's very strict about how she wants things done, and she will point out to you if you did not make the bed or the room doesn't smell right or anything. She's very good at that.
Now that we've discussed the tools needed for dental cares and the importance of doing these cares daily for each resident, let's take a look at the correct procedures when providing oral cares. In general, helping residents with oral hygiene is extremely important. Removing food and plaque from the mouth prevents tooth decay, gum disease, and tooth loss. A clean mouth also increases comfort, enhances the taste of food, improves appearance, and prevents odors. Prevention of dental problems or minimizing problems will allow staff to focus their attention on other concerns. All oral cares, like other personal cares, should only be provided in the privacy of the resident's room. This is usually easiest with the resident seated in the bathroom, but can also be done elsewhere in the room or in bed if necessary. Residents should be asked about their preferences concerning their oral hygiene and whether they would like to do this themselves or have some help.
Before entering, I knocked the door, and then they allowed me in. And then when I get in, I greet my resident and then ask him or her, it's breakfast time. Would you like to go for breakfast? Get dressed? She said, oh, sure, I would like to get dressed. And then when they are dressed, you ask them, can we go to the bathroom to brush your teeth or after? And then they say, well, it's okay, I can brush my teeth after. And then some say, oh, later, I'll come back and do that.
Oral hygiene can be provided before breakfast, after meals, at bedtime, or other times as requested or necessary. Twice a day is best to maintain good oral health, and the single most important time is after the last meal of the day or just before bed, so that food and plaque will not sit in the mouth overnight, which can quickly cause oral disease. Once teeth have been cleaned at the end of the day, it is best for the resident to avoid eating again until morning. This includes use of cough drops or candies, which are full of sugar and can quickly cause cavities. Following brushing and flossing, some residents may like to use mouthwash to help remove debris and freshen the mouth. Remember that some mouthwashes may contain strong flavors and alcohol that can also irritate the mouth of some residents, so simply rinse with water instead. Mouthwashes are never a substitute for toothbrushing, since they do not remove plaque well. It's important to note that sponge applicators also cannot remove plaque from the teeth, so they should never be used for toothbrushing. They're only useful to remove food and debris from the mouth. Any questions about difficulties in providing assistance with oral hygiene for a resident should be brought to the attention of a supervisor as soon as possible. Because some residents are not always as aware or able to communicate about pain, eating problems, or other difficulties, dental problems often go unnoticed in their early stages. Therefore, when oral hygiene is provided, it's a good opportunity to carefully look at the resident's mouth and dentures for possible signs of oral health problems.
if they have good teeth and good oral care, then they're going to be able to eat better, and it makes it easier for feeding, and so they can chew better. It makes mealtime more pleasant for them if they're not in pain.
First, ask the resident if they are having any discomfort in the mouth, difficulty in eating, soreness from dentures, or other mouth problems. Next, any dentures should be removed and checked for signs of broken denture teeth, cracks, sharp edges, or other problems. Make sure that the resident's name is on the dentures. If a name label is missing, a supervisor should be told. Finally, ask the resident to open their mouth to check for broken or loose teeth, as well as lumps, bumps, or sores on the gums or other soft tissues in the mouth. Red or bleeding gums or foul odors are an important warning sign of problems and should be noted and brought to the attention of a supervisor as soon as possible.
At times, we have residents, maybe their gums will bleed or they'll have sores in their mouth or something, and then we just tell the nurse so she can make an appointment with the dentist. When I first entered the room, I introduced myself. My name is Nicole, and I'm going to be your aide. And then I talked to them about how we're going to do oral cares. Those who ambulate, I bring them into the bathroom, and those who don't, I bring the pan to them. And then I tell them we're going to brush their teeth, or whatever it is we're going to do.
The single most important oral hygiene procedure for residents with natural teeth is toothbrushing. The things you'll need to brush the teeth of your residents include gloves, absorbent cloth or towel, emesis basin, cup for rinsing, toothpaste, preferably containing fluoride, soft bristled regular toothbrush, or a mechanical toothbrush. Begin by washing your hands and putting on a new pair of gloves. Wet the toothbrush under water, and then apply a small amount of toothpaste to the toothbrush, about the size of a large pea. Remove any dentures in the mouth. Explain to the resident what you are planning to do, and always approach from the front. Then move to the resident's side as necessary to support their head and improve your access to the mouth. Start with the upper teeth and make sure to brush all sides of the teeth, including the sides towards the cheeks, tongue, and the chewing surfaces. Gently brush the resident's teeth on all sides using small, round motions and short back and forth strokes. Pay special attention to brushing at the gum line by holding the toothbrush at a slight angle toward the gums while you brush, about 45 degrees. After you've brushed the resident's teeth for at least 2 minutes, with short breaks as needed to spit out excess water in toothpaste, offer a cup of water to rinse and spit out excess toothpaste from the mouth. Use the cloth to dry the face after rinsing. Flossing is the best way to remove plaque and food from in between teeth, but flossing someone else's teeth can sometimes be tricky. The resident must be able to open their mouth and keep it open while you floss the teeth. If the resident is not cooperative, or there is a risk that they may bite down on your fingers, then a different approach will be needed, or flossing may not be possible. There are flossing tools that can be used to make the job easier. If you have questions or concerns about how best to floss the teeth, it's good to talk to your supervisor, since the help of a dental professional may be needed.
Well, we'll explain to them what we're going to do and why we're doing it. If they have good hygiene, they can chew their food better. They feel better if they don't have tooth pain. Try to make it a routine when we are doing oral hygiene so they get used to it and involved in their cares.
When flossing is possible, it's best done once a day at bedtime, usually after toothbrushing when you have already assembled your basic oral hygiene setup. Using clean, gloved hands, tear off a piece of dental floss from the container that is long enough to reach from your hand to your elbow. Next, take one end of the floss and lightly wrap it around the middle finger of one hand, leaving about 8 inches of excess floss. Then, wrap the rest of the loose floss lightly around the middle finger of the opposite hand. You want to have about 6 inches of floss to work with between the 2 middle fingers, and you want to save your index fingers and thumbs to do the flossing. Start by holding the floss on both sides with your index fingers, leaving about 1 to 2 inches in the middle as the working part of the floss. Beginning with the lower teeth, stretch your fingers out to reach to the last 2 teeth in the back, with 1 finger on the cheek side and 1 finger on the tongue side. Using a zigzag type of movement, slide the floss down through the contact point of the 2 teeth, being careful not to cut the gum with the downward pressure. Once you're in between the teeth, use a gentle up and down motion while lightly pushing the floss toward the back tooth, and then lightly pulling the floss toward the front tooth. Pull up to remove the floss from this area and move forward to the next 2 teeth that are touching, following around the lower teeth until all the teeth have been flossed. Repeat this technique on the upper teeth as well. You may need to move around to the resident's side to gain access to the upper teeth. As plaque gets picked up by the floss, roll the soiled piece up onto the middle finger with less floss on it, and unwrap some more clean floss from the opposite middle finger. Continue in this way until all the teeth have been flossed. Offer a cup of water to rinse and spit out any food particles from the mouth. A mild mouthwash can be offered to freshen the mouth. Use the cloth to dry the face after rinsing. Just like natural teeth, full or partial dentures build up plaque, calculus or tartar, and stains. So they also have to be cleaned thoroughly as often as natural teeth to keep the mouth healthy. When dentures are not kept clean, yeast infections, gum irritation, and bad breath can occur, and the dentures can become stained. Dentures can be cleaned by the resident themselves if they're able, but if not, the staff should assist the resident as indicated on the care plan. Dentures should be handled carefully and protected from loss or breakage, since they're expensive to repair or replace.
I hear a lot of questions, or a lot of complaints about oral care and oral hygiene. A lot of them have to do with dentures, where I think residents really want their dentures to be cleaned more often. And sometimes their dentures don't fit and it's hard, or they fall out, or they're uncomfortable.
To clean dentures, you or the resident will need a denture brush or a regular soft toothbrush and some denture cleaner or toothpaste. A regular toothbrush can be used if preferred, but denture brushes are designed for this purpose and usually work better. Never use denture brushes on natural teeth. Have the resident remove their dentures, or gently remove them yourself if the resident is unable. Upper full dentures are best removed by grasping the front denture teeth with the fingertips and then tipping the back of the denture downward. Lower full dentures are best removed by grasping the front denture teeth and gently pulling upward. Upper or lower partial dentures with metal clasps are best removed by pushing upward on the clasps with the tips of your fingers. Difficulties in removing dentures should be brought to the attention of a supervisor. When dentures have been removed, it is a good time to check the dentures for signs of broken teeth, cracks, sharp edges, missing name labels, or other problems, and report such concerns to a supervisor. With the dentures removed, inspect the resident's mouth for possible problems, and be sure to clean the mouth and remaining teeth with a soft toothbrush and toothpaste as previously recommended. If the resident does not have any natural teeth, a sponge swab can also be used to clean the gums. But be sure not to use these for toothbrushing, since they do not remove plaque very well. A mild mouthwash can also be offered at this time to help remove debris and freshen the mouth as shown before. Dentures are best cleaned over a sink half filled with water and with a towel or washcloth lining the sink to act as a cushion in case the denture should drop. Gently scrub the dentures with the denture brush and paste under running water, being careful to brush both the inside and outside of the dentures to remove food, plaque, and denture adhesives. Then rinse them under cool water. Do not soak or rinse dentures under hot water, since this may affect their shape and fit. For partial dentures with metal clasps, also be sure to carefully brush around the clasps to remove food and plaque. Bedtime is usually a good time to clean dentures, since it is best if they are left out for 6 to 8 hours each day to allow the gums some time to rest to help avoid irritation or infections of the soft tissues. Dentures can also be soaked in water with a denture cleaning tablet if desired, but soaking alone will not remove plaque, so this should only be done after brushing. When dentures are not in the mouth, they should be kept in clean water, with or without denture cleaner, in a plastic denture cup, since drying them out may change the fit. Denture cleaners must also be completely rinsed off before the dentures are placed back in the mouth. When dentures do not seem to stay in well by themselves, the careful use of denture adhesives can sometimes be helpful. However, it's important to remember that using too much adhesive or not cleaning out adhesives each day can lead to gum irritation, infections, and also feel unpleasant to the resident or affect the taste of food. Too much adhesive can even make dentures fit worse and change the bite. If lots of adhesive is needed for a resident to use their dentures, report this to your supervisor so that the dentures can be checked to make sure they are not damaged and fit properly. To use denture adhesives correctly, make sure the dentures are clean and moisten them with a little water. Apply 3 or 4 small ribbons of adhesive paste evenly towards both the front and back. Have the resident place the dentures in the mouth and bite their teeth together to seat the dentures correctly. Denture adhesives can be reapplied as needed during the day, but again, it is absolutely essential that adhesives be cleaned out at least once every day so that they do not build up in the denture and cause problems. It's not uncommon to run into difficulties while trying to provide oral care. Residents with dementia or other problems may not understand what's happening to them or may not recognize you. Oral discomfort can also cause a resident to try to avoid cares.
If we find residents are resistive to oral care, we can just come back in a little while and try again, and sometimes it will make a big difference. Just explaining it to them, talking softly, and showing them and telling them what we're going to do and things like that.
The most frequent difficult behaviors are turning or pushing away, clenching the teeth, biting or attempting to bite the nursing assistant or the toothbrush. These behaviors are not uncommon and can be related to how care is provided. Consult with the family about difficult behaviors to see if they have suggestions or can help. Generally, the best way to approach this situation is to make sure the resident is comfortable and that the surroundings are as familiar and pleasant as possible. The goal is to create a routine that is easy to do and consistent each day. Use a quiet and soothing voice, slow movements, and a gentle approach. Consider the use of mouth props in consultation with your supervisor. Mouth props can usually be inserted into the mouth when the resident opens slightly, and then turned to help open the mouth wider for brushing. Mouth props must be used with caution to avoid injury to the lips or soft tissue. Explain the routine to the resident step by step, and keep it the same each day so it will become familiar.
Sometimes if the resident is agitated or nervous, just holding their hand, putting the toothbrush in their hand, or helping them brush and floss and using mouthwash, you just involve them more.
Some other approaches that can be helpful are: don't rush the person or the procedure. Stress can increase a resident's agitation. Try providing the resident with some distraction, such as turning on the TV, some favorite music, or letting the person hold something of comfort to them. If possible, let the person help by holding and guiding the hand holding the toothbrush. If there is a language barrier, find someone that can help interpret for the resident. If all else fails, try reapproaching the resident at another time when they seem to be in a better mood, since difficult behaviors can come and go. Always check with a supervisor if you are having problems providing oral care so that they can help, or request advice from a family member or dental professional. Residents who are unconscious, confined to bed, or have swallowing problems also need oral hygiene care for their comfort and dignity, but will need some special precautions to avoid gagging or choking.
Comatose patients, they're not able to articulate their needs, and sometimes because they're not eating, it is sort of nursing, or I should say nursing staff, might feel that it's not really a priority because nothing is going in. And at the time, it is very, very important that comatose patients or semi-conscious patients do have good oral care to prevent infections.
First, determine if the resident has any dentures or partial plates and remove them before providing oral care. If possible, lower the head of the bed slightly, but not less than 45 degrees. Move the resident to the side of the bed nearest you. Position the resident on their side, or turn their head to the side. Place a towel under the chin along with an emesis basin to catch fluids from the mouth. A mouth prop can be used to keep the mouth open. If the resident has no teeth, a moist sponge applicator can be used to gently sweep the soft tissues of the mouth. Glycerin sponge applicators are not needed. Brush the teeth as previously described, using a small amount of toothpaste on a moist, soft toothbrush. After brushing, rinse the resident's mouth with about 10 milliliters of clean water using either a syringe or the sponge applicator. Allow the fluid to drain out of the mouth into the basin or suction as needed. Only use mouthwash in consultation with your supervisor. After oral care, dry the resident's face and also remove and empty the basin. A water-soluble lip moisturizer can also be applied. Dentures should also be cleaned as previously described and replaced in the mouth if early in the day or stored overnight. Let's take a minute to review what you now know about oral cares for long-term care facility residents and why doing these cares daily is so important. First, the health of your mouth can have a great impact on your general health and quality of life. The ability to eat, talk, smile, kiss, and interact socially without pain or embarrassment is important, especially for older people. Regular daily oral hygiene and professional dental care can reduce the impact of dental diseases on our quality of life and general health. You know that individuals have an important role to play in managing their oral health. For those in long-term care facilities who are unable to carry out daily hygiene routines for themselves, family members and caretakers have a responsibility to assist them with these functions. Remember that it is important that facility staff performing cares for residents include daily oral hygiene as part of the care routine. This includes regular use of a fluoride toothpaste, which can prevent tooth decay, brushing twice a day, and also flossing if possible to remove plaque and reduce cavities and gum disease. Denture and soft tissue care, which can prevent the onset of oral ulcers, yeast infections, and other abnormal changes in soft tissue. Using the correct tools in the correct situation for maximum benefit to the resident. Always keep in mind that proper infection control precautions are of the utmost importance, no matter which cares are being performed. Remember that the goal for every individual is to keep a healthy mouth for life. Good daily care and regular dental visits will ensure that all the residents of Minnesota's long-term care facilities can grow old with a smile. And finally, on behalf of the state of Minnesota, the Walker Dental Clinic, and the University of Minnesota School of Dentistry, thank you for the work you do on a day-to-day basis to improve the life for residents you care for and care about.